Hello everyone. Today I'm going to talk about different mucosal lesions caused due to some diseases. So let's get started. First, we are going to talk about Apthous ulcer. So there are three types in this. One is minor, another one is major, and another type of ulcer caused due to herpes. So this is herpetic form. Okay. So what can you see in Apthous ulcer is like on the mucosa, you can see a normal ulcer. These are very common. They're very painful. And whenever you try to eat or swallow, you might have discomfort and pain. It's also known as canker sore. All right. So where is it present? Wherever there is non-keratinized tissues like buccal mucosa, labial mucosa, alveolar mucosa, floor of the mouth. So one thing is herpetic form occurs in keratinized tissues, whereas other forms occurs in non-keratinized tissues. Okay, a minor lesion will heal without scarring and major will have scarring. So minor does not have scarring, whereas major lesions does have scarring. So this was about Apthous ulcer. Next is BEHECTS syndrome. In BEHECTS syndrome, this is also a syndrome where it can be seen due to herpes. The main important feature over here is you can see multi-system vasculitis. Vascular inflammation can be seen, which is a very important feature, due to which there is presence of Apthous ulcer. So that's why this is related to Apthous ulcer, where due to multi-system vasculitis, you can see Apthous ulcer. So major form of this disease is also known as Sutton disease. Okay. So where can you see this kind of a syndrome is? You can see on the oral, you can see on the genital region, also on the eye, and sometimes on the CNS also. So it can be seen in the lips, oral region, genital region, and eyes. All right. Treatment for this is corticosteroids. Now coming to erythema multiforme. Erythema multiforme is again of two types, minor, major. Minor can be caused due to herpes simplex hypersensitivity, whereas major can be caused mainly due to drug sensitivity. So this is a self-limiting hypersensitivity reaction that affects mucosa. Okay, so major means you'll see like there is like multiple lesions on the lips. Minor is a little bit milder version. And another name for the erythema multiforme is Stevens-Johnson syndrome. All right. So there are two types, minor and major. Minor can be because of herpes simplex hypersensitivity, and major can be due to drug sensitivity. And the other name is Stevens-Johnson syndrome. Now coming to angioedema. Angioedema is when your lips become swollen. All right, when it is seen in the oral manifestation, there is swollen lips can be seen. It can happen whenever the person might have some allergic reaction, like the person might have allergy to any substance, and when it comes in contact with it, their lips might look swollen. And this is happening mainly because of release of histamines and also IgE, which is mediated by the mast cells. So in that case, what would be the treatment is you will give antihistamines so as to block those histamines. All right. Next, we have Wegeners' granulomatosis. So it is nothing but a granulomatosis where you can see a lot of granulomas along with necrotizing lesions. Okay, and here the gingiva will be solid red color resembling strawberry. So therefore the gingiva is called as strawberry gingivitis. Okay, and this is also an allergic reaction, but that is caused due to inhalation. Mainly here you're inhaling the antigen, whereas in the previous angioedema, you're coming in contact with the allergens. And the treatment over here is corticosteroids. Okay. Prednisones is given, and also cyclophosphomides are also given. So another thing I want to inform is there is a difference between Wegener's granulomatosis and angioedema, because Wegener's granulomatosis, you're inhaling the antigen over here. Coming to lichen planus, I have already explained in detail about the lichen planus. In case you did not check out my video, please do check my video, which I'll insert at the end of this video. But the most important thing to remember here is it is a mucocutaneous lesion. Okay, it is a mucocutaneous disease, and the there are different types, but reticular type is the first most common type, and next common type is the erosive type of lesion. And important features of lichen planus is you can see Wickham's striae, which is very important, where the lesion looks like red color with surrounding white lesion. So that is called as Wickham's striae. Now, coming to histology part, what happens is exactly, first there is hyperkeratosis. There is a lot of keratin deposition. Then what happens is lymphocytes get infiltrated at the epithelium and connective tissue interface. Okay. Now, due to which there is basal zone vacuolization. And because of the destruction of this basal zone due to T lymphocytes, you can see sawtooth shaped retipex in the epithelium, which is a very important feature of this lichen planus. Okay. So that is what you have to remember in the lichen planus, that Wickham's striae is the important feature where red and whitish striations can be seen. Reticular type is the most common type. Erosive is the next most common type. And what are the features that you can see is hyperkeratosis can be seen, and next lymphocyte infiltration at the epithelial connective tissue interface can be seen. Then you see basal zone vacuolization, and sawtooth retipex can be seen in the epithelium, which is secondary to the destruction of the basal keratinocytes, because that is being destroyed by T lymphocytes. Now coming to lupus erythematosus. Lupus erythematosus is two types. One is discoid and another one is systemic acute. So discoid means disc shape can be seen, very simple to remember, and it can be seen on oral, face and scalp. So disc shaped lesions can be seen, whereas in systemic acute, actually on the nose, there will be a butterfly shaped rash. Okay. And in systemic, multiple organs will be involved. And butterfly rash is an important feature, and the ANA test is used to diagnose. Now, treatment is corticosteroids. Let me tell you another important thing. This discoid shape of lupus erythematosus, differential diagnosis is lichen planus because it resembles lichen planus. Okay. Next we have scleroderma. Scleroderma, derma is a face lesion, like a skin lesion, right? Derma means skin lesion. what happens in the scleroderma is there is hardening of skin. So you might think, how is this related to the dental aspect? So when your skin becomes hard, it becomes difficult to open your mouth, right? So then, due to which there might be problems where PDL might become widened. Okay. Now, this is about scleroderma. Next, we have pemphigus and pemphigoid. So we have pemphigus and pemphigoid. So pemphigus, what happens is there is a very minor difference. In the pemphigoid, this lesion is subbasilar and this is above the basal membrane lesion. So here, autoantibodies are produced against desmosomal protein. All right. Whereas in pemphigoid, antibodies are produced against the basement membrane. All right. So what happens in the pemphigus? This is suprabasilar lesion. All right. And pemphigoid is subbasilar region. Here, autoantibodies are produced against desmosomal proteins, and here it is produced against basement membrane. And the treatment is corticosteroids. So this is the last lesion I wanted to discuss. I'll give a quick review. So about pemphigus and pemphigoid, pemphigus is mainly suprabasilar, pemphigoid is a subbasilar lesion. And what happens in the pemphigus is autoantibodies are produced against desmosomal proteins, whereas in pemphigoid, they are produced against basement membrane. Now, scleroderma is hardening of the skin can be seen, due to which there might be different problems where opening of the mouth can be hard. Lupus erythematosus is of two types, discoid and systemic. Acute discoid is disc shape, can be seen on oral as an oral lesion or on face and scalp, and it resembles lichen planus, whereas systemic acute, it is acute, whereas discoid is more chronic. And in systemic acute, there will be a butterfly rash on the nose, and it can spread to multiple organs. And the test that confirms is ANA test. Now coming to lichen planus, I have already discussed in the video. In my other video, I'll leave it in the description. You can check it out. But the important thing to remember from this class is Wickham's striae, lichen planus, which is a very characteristic feature of lichen planus, where you can see red color lesions covered by white striations. All right, and reticular is the most common type and erosive is the second most common type. And histological features is hyperkeratosis can be seen. And then next what happens is lymphocyte infiltration can be seen at epithelial and connective tissue interface. Then you see basal zone vacuolization. And last, epithelium exhibits sawtooth retipex, which is secondary to the destruction of basal keratinocytes and due to which are mainly destroyed by T lymphocytes. Now we have Wegeners granulomatosis. This is nothing but granulomatosis that is necrotizing. And in the gingiva, you can see that it is completely necrotized. So it looks really red shaped. And that is because of allergic reaction, where it is not because of the allergic reaction that comes into contact, but it is when you inhale the antigen. And the treatment is corticosteroids and cyclophosphomides. Angioedema is when you come in contact with an allergen. Histamines and IgE, immunoglobulin E, are released by the mast cells. So the treatment is to give antihistamines. And erythema multiforme are of two types, minor and major. Minor is because of herpes simplex hypersensitivity, and major is because of drug sensitivity. This is also called as Stevenson-Johnson syndrome. BEHECTS syndrome is nothing but it is an Apthous ulcer caused due to multi-system vasculitis. Major form is also known as Sutton's disease. It's very important. It can be seen in lips, genitals, eyes, and sometimes affects CNS. Also, treatment is corticosteroids. Now, the first thing we discussed was Apthous ulcer. Three types are present: minor, major, and herpetic form. Herpetic form, you can see that it is present. These ulcers are present in the keratinized membranes, and minor and major forms are present in the non-keratinized membranes like buccal mucosa, oral mucosa, alveolar mucosa, and soft palate and everything. So it is also known as canker sore. And minor, there will be no scarring, but major, there will be a scarring. And another thing I wanted to explain before I end today's topic is pemphigus, you see a positive Nikolsky sign. Now, what it is means whenever you try to, suppose, slough the area, when you touch the uppermost area, what happens is it rubs away. The top layer will slip away because it slides over the lower layer. So you can see that as a positive Nikolsky sign. Thanks for watching. In case you have enjoyed my video, please like, share, and subscribe. Thank you.